Hello, everyone. This is Dr. Marzban from Marzban Family Chiropractic, Complete Injury Centers, talking from Carrollton, Texas. Today, I'm going to be talking about leg length discrepancy briefly, and because many of the patients that they go with the back pain, neck pain, those things, even the legs, the clinician is talking about the leg length. One leg is longer than the other one. And I just want to briefly talk about that, how the clinician can use it or not correctly uh, uh, targeting the cause of the issue. And one out of the three general population, they have the leg length discrepancy of 1 or more than 1 centimeter. And in order to have a leg length discrepancy to be significant for the health, and it should be more than that. It should be around 2 centimeters. And so the amount of the leg length discrepancy, it is important. Sometimes is insignificant to even uh, deal with it. But if it is about 2 centimeters, which is the 3/4 of an inch, then it can be significant. And there are different ways of measuring the leg length. And on the left side, you notice that the patient is going to be laying down the back, the knees are bent, and they measure the length of the height of the knees, which is a good way to do it. And the other one is this one right here from the point right here, which is called ASIS, to the medial malleolus, and or from the belly button to the same part of the ankle. They can be measured and on bilaterally, and then they compare one side to other side, which is also very good way of measuring the leg length. And the last one that most of the clinicians in the office, they measure that, and at least in the chiropractic field or the physical therapy offices, and patients supinal prone, which is not the best way to do it. And there are many factors how the patient is being laying down on the table, or the even if the patient has a little bit big belly, putting the patient facing down can change that. And most of them, they don't have the correct table to get that thing done. But again, we did the some experiment, and it shows that even the patient is correctly being placed on the table, uh, it is very difficult to have reliable measurements amongst the clinicians. And these two are the best way to do it. This is the quick thing to do, and then anybody who's doing this one has to make sure they're doing it right, and don't and consider also other factors could be changing that. And the leg length discrepancy can be either anatomical phenomenon or it could be functional issues. And so if it is the anatomical phenomenon, which means that in this case, for example, right here, and one leg is longer than the other side, and because of the growth of the bone, for whatever reason is, are different one side to other side, then making this one as a big deal that your spine adjustment can fix this, or fixing the a spine to correct this may not be a reliable way of looking at that. And but again, the treatments of the spine and the muscles and the fascia, they are good for removing the symptoms, but correcting those and making the legs to be equally length, and that is not a good way to do it, because making the length of the legs equally as far as the measuring it at this way, may not be something that the patient is going to benefit from. So it is important what is the cause of the leg length discrepancy. If it is the functional, in this case right here, then that is very important to find out how to deal with the issue. The left leg the discrepancy, for example, in this case, which it seems like the left side is shorter than the right side. The pelvis is dropped on the left side, and there is a curvature happening in the spine due to that. And then if somebody look at this one, so well, is it the scoliosis causing that, or is the hip misalignment causing this leg to be short, or in this case, definitely is the ankle. So clinician has to be carefully measuring the leg length correctly and also examining the whole structure from the top to bottom to detect the cause of it. And again, adjusting of the spine or myofascial work or changing the pelvis at this case to become equal, that is not going to be removing the cause of the problem. And the problem is going to keep coming back as soon as the patient is getting up or leaving the office. So it is not a good way just to look at the other areas, not being able to detect the cause of the issue. And in this case, it shows that it could be myofascial issue, that the one side is tighter than the other side from the top to bottom, and imbalance of the myofascial structures and functions. It can cause the one side to be shorter than the other side. So adjustment of the spine may not be the only thing that the patient needs. It needs to have a balance of the myofascial and the muscle strength and the length. And many cases, people that are sitting down at work and for example, the hamstring muscles become tight, or there's a muscle in the front deep to the back. It's called the iliopsoas muscles. They can be shortened, and all of those structures can be causing the leg length to be unequal due to the lifestyle. And so if the clinician is not talking about the lifestyle change to get the patient a better life, a better structure, better health, then only dealing with the myofascial or the skeletal system adjustments may not be a good way to deal with the issue that the patient has, and it's not going to last very long. And in this slide, it shows that, well, we have somebody can have the anatomical issues, or it could be because of the myofascial or the misalignment of the spine, it causes the scoliosis. And that in that case, you see that one hip is going to be dropped, and the hip that the side is dropped, usually it is going to be, in many cases, it shows the short leg, but in this case, because the hip is tilted because of the scoliosis, it might show that the left leg is longer with laying down because it's pushed down in that case. And so all of those could be the cause of the problem that the patient has with the structural in this case. And here is the functional, the structural scoliosis if the patient has the congenital issues or some other issues like a disc injuries, or it could be the functional because of the misalignment of the spine or the myofascial issues that are not balanced out right and left side. And for example, on the right side, it shows that the muscles, primary, those muscles that are mentioned right here, they can cause the leg length to not to be equal and nothing wrong with the spine itself. It needs to have the myofascial work out, or it could be a combination of the two with the alignments as well as the of the spine, my alignment of the spine, or the myofascial muscles around the area. For example, in this case here, can cause the leg length not to be equal. And it is very important when you go to an office and the clinician and the therapist they're talking about the leg length are not equal. It should be done correctly. The examination should be done correctly, and also they need to find the cause of the issue so they can fix the problem, not the other things that are the symptoms or the secondary to the leg length not to be equal. Again, that is a take-home lesson for today. I hope it is beneficial to you, and I wish you the best. Talk to you soon. Bye-bye.